Hi, everybody. It's Patricia Coughlin. I wanted to let you know about an upcoming training that I will be doing with Dr. Jonathan Entis. The two of us are going to present a full day webinar in May. It's May 16th. And the topic is identifying, understanding, and effectively working with defenses and resistances against emotional closeness. Now, this was one of the great innovations of Habib Davanloo. He realized that patients not only employed what we might call formal defenses like intellectualizing, displacing, rationalizing, somatizing, and so on. These are defenses that the patient uses to avoid anxiety provoking and guilt laden feelings. It's really between him and him, okay? And yet, what Davanloo started to realize over time was that patients used other kinds of defenses that he came to call tactical defenses. These are interpersonal defenses that patients use to keep an emotional distance from others, including the therapist. So they might avoid eye contact, sit with their arms and legs crossed, sometimes even with their coat still on throughout the session. They'll jump from topic to topic, say one thing, take it back. All kinds of ways to create sort of um, smoke screens and really eventually what he would call a wall against genuine emotional contact. Right, you can have patients who, they physically come to sessions. In fact, they're religious about it. They're always on time. And they're intellectually, cognitively involved, but completely emotionally detached. And if that's the fact, it doesn't matter how empirically validated or effective your treatment might be on paper, the person is not open and available to it. And as long as that's the case, you're not going to be effective. It's just all your interventions, no matter how brilliant, are just going to bounce off that wall of connection. So, again, in this seminar, we're really going to talk about how to identify when the patient has these defenses that together form a resistance against the kind of emotional involvement that's necessary for deep and transformational change. And then we'll help you to identify what the nature of the conflict is that's responsible for those defenses. So, in general, there are two different categories. It can either be that the patient resists emotional closeness with everybody. They have character defenses. So these are characteristic, rigid, habitual defenses that affect them in all their relationships with family, with friends, with co-workers, bosses, and so on. So they might be passive and compliant or sarcastic and defiant with everybody. So you are no different. And you're going to deal with that in a particular way. But in other cases, the patient might have lots of close friends, even have a good close relationship with their partner, but have particular conflicts with authority, and they might consider you as the therapist a member of that group. And so that would be more of a transference resistance. So whether you're dealing with a character resistant patient or an transference resistance is very important because you are going to deal with those very differently. So we're going to have examples of both, and you'll be able to see the actual cases. And also you'll see the ways in which Jonathan and I work similarly. I mean, we have, sort of the same theoretical foundation for our work, and we both, call it ISTDP. And yet we have somewhat different styles, and some of that is a personal style, and some of that It's just a difference in what we tend to emphasize. And so that'll be important, and we'll openly talk about our similarities and differences. So I hope you will join us on May 16th. If you look down on the below the video, you will see the link to sign up and register for the webinar. So we will see you in May. Okay, thanks. Bye-bye.